everyone, my name is Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Before moving ahead, I would really appreciate if you all subscribe my channel Nurses, the Heart of Healthcare, and if you find the content helpful, then please do like and share my videos with your friends. Hope you all are doing great and enjoying the rainy season. The theme of this video is to help all those enthusiastic nurses who are looking forward to work in the most exciting and challenging area of the hospital, that is emergency department. So if you are preparing for an interview for emergency department, then this video is for you. So let's get started. The first question that you may come across is, what made you want to become a nurse in emergency department? Means the interviewer wants to know why you want to become an ER nurse. What made you, why you are interested to work in emergency department. So how will you answer this? You can start with like the emergency department is an essential area of any hospital because it often deals with life and death situations. Emergency room is often hospital's first point of contact for people from all walks of life, and being able to help others who are going through an emergency is usually one of the most rewarding parts of working in ER. In ER, no two shifts are same. Yes, in nursing field itself, no two shifts are same. So as an ER nurse, you will always be seeing something new, face new challenges, and get to take new tasks. And we get an opportunity to learn many new skills, and we can enjoy the fast-paced and multitasking working environment in emergency department. So working in ER is most satisfying, fulfilling, and exciting job, and hence I want to work in emergency department, the most challenging, exciting, and fast-paced working area in a hospital. So this is how you can answer this question. The next question that you may come across is, what qualities do you believe a successful ER nurse needs? Means like the interviewer wants to know what are the qualities that you need to have to become a good ER nurse. So the first and foremost quality that an ER nurse should have is quickness. Working in an ER requires you to be quick on your feet and remain in control. Means quick thinking and acting. Okay, so thinking quickly and acting quickly is the first and foremost quality that requires to work in emergency department. And next is prioritizing effectively, because ER is a place where you receive a lot of patients from morning to night. So you should quickly triage the patients based on their immediate observation and acute assessment skills, and then treat the symptoms in order of life-threatening priority. And the other qualities are like need to be ready to spend long hours on your feet and be able to move and lift the patients if necessary. And working in ER requires strong professional and emotional foundation. ER nurse need to be competent, empathetic, and very, very quick. And we also need to master the art of remaining calm and continue to perform our duties in chaotic environment, because working in ER is a stressful job. We need to work under a lot of stress, so ability to remain calm under stress, under pressure is very important. And another quality that we need to possess is being flexible, because it is a key skill for an ER nurse, where patients need keep changing. Okay, so patients need can change quickly, and we must be able to respond immediately to those changes. And the other quality that an ER nurse requires is like the ability to work in team and escalating the situations and communicating effectively. Very, very important, effective communication. Okay, so these are the qualities that require to become a successful ER nurse. The other question that you may come across is, what is triage? Okay, so triage, as we know, it's very important, yes, in emergency department. So they may ask what is. So we can start with like triage is originated from a French word called trier, and it means to sort or to choose. So triage is the process of prioritizing or classifying the injured victims according to the type and urgency of their conditions. The main purpose or the main objective of triage is the right patient goes to the right place at right time with right care provider. That's the main purpose. Okay, so identifying the patient requiring immediate care and determining the appropriate area for the treatment and facilitating the patient flow through emergency department to avoid unnecessary congestion is the main objective of triage. So this is what triage means. Triage means to prioritize or classify the injured victims according to their urgency, according to the urgency of their condition. So right patient to right place at right time with right care provider. This is what triage means. Then the next question that you may come across is, which patients get the highest priority during triage? So when we receive a patient in emergency department, first the patient is taken into the triage area, and then after the initial assessment, as per the patient's requirement, the patient is prioritized whether they will go to P1, priority 2, priority 3. So those patients who go to priority 1 are those who require immediate life-saving interventions, those who require urgent surgery, those who are expected to receive immediate medical attention. Like for example, those patients with cardiorespiratory arrest, those patients with internal hemorrhage, polytrauma, serious accident cases, cardiac arrest, or we can say any cardiac events including suspected heart attack, suspected stroke, severe burns, shock of any etiology, may it be cardiogenic shock or septic shock or anaphylactic shock or neurogenic shock, shock of any etiology, respiratory failure with a need for ventilation, then those patients with impaired consciousness like GCS is less than 9, or those patients for whom intubation is indicated to protect their airways, and for those patients with thoracic injuries like there is massive hemothorax or cardiac tamponade or thoracic abdominal injuries. Okay, and those patients with threatened airway. Okay, so all these are the patients who will go to priority 1. Then the next question that you may come across in an emergency department nursing interview is, what are shockable and non-shockable rhythms? Okay, very important for an emergency nurse to learn about it and be able to identify and escalate it. So the shockable rhythms are VF, that is ventricular fibrillation, and pulseless VT, that is pulseless ventricular tachycardia. And non-shockable rhythms are asystole and PEA, that is pulseless electrical activity. In SVT, it is that is supraventricular tachycardia, we are doing synchronized electrical cardioversion. Whereas in shockable rhythms, we give shock using defibrillator, and in case of non-shockable rhythms, that means that defibrillation is not effective treatment, so they are going to continue with the CPR and medications. Okay, so shockable rhythms are treated with shock and medications. Non-shockable rhythms, they are going to continue with the manual CPR or they use a Lucas and medications, whereas SVT, it is treated with synchronized electrical cardioversion. So we must know this 5 rhythms. Okay. Then the next question that you may come across is, what are defibrillators? Defibrillators are nothing but they are the life-saving devices that provides an electric shock or current to your heart to allow it to get it out of the potentially fatal abnormal heart rhythms. Okay, so when the patient is suffering from arrhythmias, VT or VF or SVT, they are going to use defibrillator. Okay, so to get the patient back to the normal rhythm. Okay, so defibrillation is an important step in CPR. There are different kind of defibrillators. Manual models are the one which we are using in emergency department. Okay, outside the emergency department, we have AED available which can be used even by the non-professionals. But defibrillators are the one which are used by the professional healthcare providers. Okay, it requires good knowledge how to operate it. Okay, because in this it is the healthcare provider who's going to decide whether the shock to be given or not. Okay, the rhythm is analyzed by the healthcare provider, and it is he or she who's going to decide whether the shock to be given or not. Then the next question that may be asked in the interview is, what is the difference between BLS and ACLS? BLS, which stands for Basic Life Support, is performed in the beginning stages of the emergency, whereas ACLS, which stands for Advanced Cardiopulmonary Life Support, it is a supportive medical care that healthcare professionals use to continue the treatment in the hospital. BLS focus mainly on the basic life-saving techniques such as the CPR and the use of AED, that is automated external defibrillator, whereas ACLS, it involves more advanced intervention that goes beyond BLS. So in ACLS we have administration of medications and placing advanced airways like endotracheal intubation or laryngeal mask airway. Okay, so in BLS it is like ABC, okay, that is circulation, breathing, airway and breathing. This is what we are going to look for. Okay, whereas in ACLS it is ABCD. The D stands for differential diagnosis. Okay, so we are going to identify why the patient has become pulseless. Okay, so they are going to identify the cause and treat it accordingly, whereas in BLS they are just focusing on maintaining the brain perfusion by giving chest compression, whereas in ACLS they are trying to identify the cause of the cardiac arrest, that means the reversible causes of cardiac arrest, and treat it accordingly. And in BLS they are using AED. Okay, it's a machine in which there is a pre-recorded instruction, and the machine will analyze the rhythm and give instruction whether the rhythm is shockable or not. So to give shock or not, it is decided by the machine, whereas in ACLS they use defibrillator, and the decision making of whether to give a shock or not, whether it is shockable rhythm or not, it lies with the healthcare provider. Okay, so this is the basic difference between BLS and ACLS. Then the next question that you may come across is, what are the reversible causes of cardiac arrest? Or they may ask you like, what are the 5 H's and T's of ACLS? It's very important. Okay, this is what the difference that we were talking about in the last question. Okay, differential diagnosis. Okay, in ACLS we are trying for, that is A, B, C, D. That D stands for differential diagnosis. See, fortunately there are many causes of cardiac arrest that are reversible, and they are referred by the mnemonic 5 T's and 5 H's. So the 5 H's are, one is hypoxia, hypovolemia, hydrogen ion imbalance, that is acidosis, hyper or hypokalemia, and hypothermia, wherein the body temperature drops to less than 35 degrees Celsius. Hypoxia and hypoxemia, there is a difference. Hypoxia is decreased oxygen level in the tissues, whereas hypoxemia is the decreased oxygen level in the blood. Then hypovolemia, that is decreased blood volume, fluid status. Okay, and hydrogen ion imbalance, that is metabolic acidosis, that we need to rule out and treat it accordingly. Okay, then the 5 T's are, first is the tension pneumothorax. Okay, pneumothorax, that is when the air gets accumulated in the pleural space. Okay, that is the space between the layers of that surrounds the lungs. Okay, or cardiac tamponade, that is when excess amount of fluid gets accumulated in the in the pericardial space. Then next it can be because of the toxins, that is drug toxicity we need to rule out, maybe because of the opioids or benzodiazepines. Then next is thrombosis, that is if it is coronary then it is myocardial infarction, and if it is pulmonary then it is pulmonary embolism. Okay, so these are the 5 T's and 5 H's, which are the reversible causes of cardiac arrest that we are going to look for in ACLS and treat it accordingly so that we can help the patient survive. The next question that you may come across in the interview is, what are the qualities of good CPR, or what is high quality CPR? Okay, so the components of high quality CPR is, the first one is push hard, push fast. Push hard means like compressing the chest to a depth of 2 to 2.4 inches or 5 to 6 centimeters. Okay, and push fast is achieving the rate of 100 to 120 compressions per minute. So push hard and push fast means compressing the chest at an adequate depth and at adequate rate. Then the next component of a good quality CPR or high quality CPR is allow complete chest recoil after each compression. Means after each compression we need to let the chest expand completely, because this creates a relative negative intrathoracic pressure that draws the blood back into the heart. Okay, so when we allow the chest to fully expand, it promotes venous return and promoting the cardiopulmonary blood flow and coronary artery filling. So allowing the chest to recoil after each compression is again a very essential part of good quality CPR. Then the next is minimizing the interruptions in compression. So we need to minimize the interruptions. Okay, we need to have the backup and minimize the interruptions in compressions. And then next is avoid excessive ventilation. Okay, so the patient who are suffering from sudden cardiac arrest requires high quality CPR. Okay, so for a high quality CPR, these four are the essential components that we have discussed just now. Then the next question that you may come across in an emergency department nursing interview is, what are the complications of CPR? Though CPR is a life-saving procedure, okay, which saves life in emergency situation of cardiac arrest, there are some complications and side effects associated with it. The most common complications of CPR is rib fracture or breastbone fracture. Okay, especially in elderly patients, because the ribs are very brittle, and rib fracture and breastbone fracture is very common. Okay, and the other complications that are associated with CPR is aspiration and vomiting, okay, which can lead to aspiration pneumonia too. And then internal brain injury, okay, because during the CPR process the human brain receives 5% less oxygen than the usual, and abdominal distension, okay, that is gastric insufflation, and collapsed lung, there is a risk of pneumothorax, and sore chest, that is because of the repeated pushing, there's okay, the chest becomes sore, and bleeding complications, intra-abdominal bleeding complications can also occur. So these are the few complications or the side effects of this life-saving procedure called CPR. Then the next question that you may come across is, how do you handle a patient with suspected cervical or back injury? See, receiving a trauma patient in emergency department is very common. We receive a lot of patients with trauma, and when we receive a patient with suspected cervical or spinal injury, then the first and foremost thing that we need to do to avoid further injury to the patient's spine is application of cervical collar. The first thing that we need to do is apply a cervical collar to immobilize the patient's neck to prevent further damage to the patient's cervical nerves. Okay, and then to turn the patient or to examine the patient or to transfer the patient, we need to follow a maneuver called log roll maneuver. Okay, it's a technique that is called log roll maneuver or log roll or log rolling. Okay, it's a maneuver, it's a technique which is used to move the patient without flexing the spinal column and immobilizing the neck, okay, without twisting or bending the patient's body. This technique helps to move the patient with spinal injury, okay, and to facilitate vomiting, and during the transportation also it is helpful, and it also allows the medical examination of the trauma patients. Okay, so when we need to turn the patient around for medical examination to look for the patient's back for any bruises or injuries or abrasions or lacerations or fractures, then we should turn the patient using a technique called log roll maneuver. Okay, to do this we require 4 healthcare providers. Okay, so one healthcare provider, as you can see in the picture over there, will be standing at the head end of the patient. The other will be at the mid chest of the patient. The third one will be at the at the what we say, at near the buttocks or at the legs, and then the fourth will be the one who will be examining the patient's back for any bruises, abrasions, injuries or lacerations. Okay, so the one who's standing at the head end will be controlling the movement. Okay, so he will be grabbing the patient's shoulder, okay, and immobilizing the patient's neck between his forearms, and the person who is standing at the mid chest will grab his shoulders and the buttocks, and the one who is standing at the legs will be grabbing the patient's flank region and the legs, and then on the count of 3, when the person at the head end says log roll, they are going to turn the patient around, at the same time avoiding the twisting and bending, okay, so that they can prevent further damage to the patient's spinal cord. Okay, so this technique, we can say that it's a kind of spinal immobilization technique to prevent further spinal cord injury in case of trauma patients. So log roll maneuver is one we need to be very familiar with, and we need to be able to do this when we are working in the emergency department. It's a very important part of trauma care. Then the next question that you may come across is, what is Lucas device? You might have come across this device in emergency department as well as in ICUs. This is called Lucas device. Okay, so the Lucas, it is an abbreviation. It stands for the Lund University Cardiopulmonary Assist System. Okay, Lucas stands for the Lund University Cardiopulmonary Assist System. It is a device that provides mechanical chest compressions to the patients in cardiac arrest. It is an external cardiac compressor. Okay, so it can give chest compression to the patients continuously at proper rate, proper depth and proper quality for a patient in cardiac arrest. Okay, so it is proven to be safe and effective, and it can prevent strain on the first responders. Okay, so it is designed to use in patients over the age of 12 suffering from non-traumatic cardiac arrest. And this Lucas machine, it is having a rechargeable lithium polymer battery, okay, which typically lasts for about 45 minutes of operation. And you can, as you can see in the picture, how they are going to fix the device around the patient's chest, and then there is a piston like thing in the center which is going to provide compressions, and this it's a device that we are going to adjust the rhythm and adjust the rate and everything, and then it does accordingly. And in case if the patient is very huge or very well built, and if the device does not fit on the patient's chest, then immediately start manual CPR. Okay, so don't waste time, as we know that the time is very crucial when it comes to cardiac arrest and stroke. So each and every second counts. So if the Lucas machine is not fitting around the patient's chest, then immediately start manual CPR. The next question that you may come across is, how do you manage bleeding in trauma patients? See, we come across a lot of patients with trauma in emergency department, and when it is bleeding, how to manage that we must know. So uncontrolled post-traumatic bleeding is the leading cause of potentially preventable death among the trauma patients. So controlling bleeding is very important, very crucial step in management of trauma. Regarding the hemorrhage control, we should know that the location of the bleeding is critically important, because we should know it is compressible or non-compressible. If it is compressible, then we can apply direct pressure over the bleeding point, over the area where it is bleeding, or we can apply a tourniquet or a pelvic binder to prevent further blood loss. But if it is not compressible, then we need to go for the medical management. And if possible, we can also raise the injured limb above the level of the heart. Okay, and then they give IV medications like tranexamic acid, okay, TXA. It is an anti-fibrinolytic drug. Okay, it is IV TXA is the most commonly used in severe bleeding. Okay, for the patients who are requiring massive transfusion protocol. Okay, so TXA or tranexamic acid, it promotes blood clotting by preventing the blood clots. And the other thing that we can do is we can also give vitamin K. Okay, it is as we know, it's a clotting vitamin. So these are the few things that we can do, and if it is internal bleeding, that need to be ruled out and then treated accordingly. And if it is mild, we can manage it, or if it is severe, it requires an immediate surgical intervention. Then the next question that you may come across is, what is EFAST scan? EFAST scan, okay, this is one of the important scan that we performed in trauma patients, in polytrauma patients. Okay, so EFAST, it stands for extended focused assessment with sonography in trauma. Okay, EFAST, it stands for extended focused assessment with sonography in trauma. So it is a bedside ultrasonographic protocol which is designed to detect peritoneal fluid, pericardial fluid, pneumothorax, hemothorax in trauma patients, so that they can be identified and treated accordingly, immediately. Okay, so they are going to assess the 5 areas, that is the pericardial view, the right flank view, the left flank view, the pelvic view, and the anterior pleural views, so that they can rule out if the patient is having pneumothorax, hemothorax, or if the liver or the spleen they got injured, or if there is any lung injury or injury to the heart or the pelvic region, or if there is any accumulation of the blood or the fluid in the peritoneal area. Okay, so this is EFAST scan which is performed in trauma patients. Then the next and very frequently asked question is, what is fast stroke sign? Okay, what is B fast? The warning signs and symptoms of stroke. Okay, so this we need to be very familiar. B fast, it's a mnemonic. Okay, B stands for balance. That is, as we know about the stroke, right? So B stands for balance, that is loss of balance or headache or dizziness. And E stands for eyes, that is blurring of the vision, okay, in one or both the eyes. And F stands for facial drooping. Okay, in a stroke patient there is facial drooping. When we ask the patient to speak or to smile, okay, they will be sagging, facial sagging or drooping on one side of the face. Okay, so which is noticed when the patient is trying to speak or smile. And then A stands for arm or leg weakness. Okay, there is difficulty in raising or moving one or more limbs. Okay, then S stands for speech difficulty. Okay, the patient will have slurring of the speech, or they may not be able to speak even simple sentences sometimes. And T stands for time to call. Okay, the time when the signs and symptoms or we can say that the time when the patient was last seen fine and these signs and symptoms noticed. Okay, so it is time to immediately call the emergency, and so that we can minimize the long term effects of the stroke. Okay, so we must know what is B fast. B stands for balance, E stands for eyes, that is blurring of the vision, F for facial drooping, A for arm or leg weakness, S for speech difficulty, and T for time to call. Okay, so hope this helped. So these are the few very important and very frequently asked questions if you are preparing for a nursing interview for an emergency department. So guys, emergency department is really a very exciting, challenging, multitasking and area where you can learn a lot, and where you come across, you face new challenges. Okay, so to prepare for an interview for this area, we must be familiar with these 15 questions that we have discussed in this video. Hope this helps you, and if you find it helpful, then please do like, share and subscribe my channel, Nurses, the Heart of Healthcare. Thanks for watching. Stay connected.